Alongside doctors and nurses, they are the unsung heroes of the COVID-19 crisis. Respiratory therapists are on the front line, the ones who operate the life-saving ventilators, making sure oxygen is getting in. And joining us now this morning is Tina Sue, the Education Director at the BC Society of Respiratory Therapists. Thanks for taking the time for us this morning, Tina.
Good morning. Thanks for having me.
First of all, thank you to you and the hard work of all of the respiratory therapists in BC and across the country. Give us a sense, first of all, what the role of a respiratory therapist or an RT is during this COVID-19 crisis.
Sure. Our role is definitely frontline. We operate the ventilators, so the life support machines, which will be our main role with the COVID patients.
So I understand there's about 1,300 RTs in the province. Tell us about what the workload is like right now.
Yeah, workload is okay right now. Luckily, our government did anticipate this crisis, and I'm seeing a lot of proactive changes out there. So we were able to drop our usual workload to make way for the COVID patients that we're seeing at this time.
And what preparations have been done if there is an anticipation that the demand for your work could get even higher?
Yeah, the anticipation is very real, and the changes are coming fast and furious. It sure is a time for preparation, and I feel like our healthcare system is one of fluidity and very dynamic right now. Changes coming from the top down. We certainly feel it at the front lines, and they're very open to taking feedback about the changes, how things are going. So every day brings something new.
I wonder if you could give us a sense in layman's terms. What is happening to a patient who has COVID-19? What is going on within the respiratory system? Maybe explain to us what you're seeing.
Sure. The biggest problem is inflammation. We're talking about cytokine storms. So the lungs are getting angry and inflamed, and the tissue, the very fragile lung tissue that allows gas to pass from the atmosphere into our bloodstream, is thicker than it should be. And so it's very difficult for oxygen to pass from the inside of your lungs into your blood. And that's the main problem we're having.
And so many of these patients need to be on respirators. Maybe give us a sense of what the ratio between RTs and respirators is in BC.
Sure. So a normal ratio in the intensive care unit would be about 1 RT to 4 or 5 ventilated patients. That's fairly workable for us. Right now, we're still able to maintain those ratios. So right now, we're doing okay, but we are anticipating those ratios to get higher for us. So we'll be seeing more patients per RT. We're trying to free up more RTs that work in the community, training them to come back into critical care to help us up so we can maintain those ratios. But for right now, we're okay, but we're trying to streamline things so that we can become more efficient as the demand increases.
I wonder if you can give us a sense what's happening on the front lines. What is morale like in some of these hospitals and other facilities where you're seeing patients day in and day out?
Yeah, there's certainly a buzz on the respiratory front. We're all talking to each other. We're sort of a small population of healthcare workers, so we're fairly close-knit. And there's certainly this electricity, I'll say, about anticipation. We are a group of people that likes a challenge, so there's certainly mounting excitement about that. But there's also a very real fear about having to see a lot of people die and about not being able to provide the care that we want to provide. Well, so there's a lot of mixed emotions right now.
You are all doing tremendous work, and we can't thank you enough for the work that you're doing. And I hope that you are able to hear nightly the big 7 o'clock noise, the sounds of people honking their horns and cheering you on, because you deserve every bit of that.
Thank you so much. It's been great. I love hearing it. I go outside just before 7 on my patio, and I hear all the other patio doors opening and people coming out, and kids are banging pots and pans. We really do feel the love, so thank you.
Okay, Tina Sue, thank you so much for joining us this morning, speaking with us about the role of respiratory therapists during this COVID-19 crisis. Thanks, Tina.
Thank you.